Hi, my name is Michelle Hamilton, and I'm here with my colleague and good friend, Mara Pinot. We are two oncology dietitians here at the UT Southwestern Harold C. Simmons Comprehensive Cancer Center. We are both registered dietitians and certified specialists in oncology, and we're here to discuss ways to manage some treatment-related symptoms. Some of the symptoms we will be discussing today include nausea, vomiting, diarrhea and constipation, taste changes, dry mouth, poor appetite, and weight loss. We hope that you learn a lot today, but we also hope that you know that you have access to a dietitian throughout your treatment. Feel free to follow up with your individual dietitian for any additional questions. Now let's get to it.
Thank you, Michelle. So first, we want to discuss, just briefly discuss the importance of nutrition. Why do we need to talk about nutrition in the first place? And there's many reasons for that. So nutrition care during treatment can greatly impact a person's ability to tolerate treatment and thus improve health outcomes. In addition, nutrition can also help decrease cancer reoccurrences, improve well-being while on and off treatment, and correct nutrition deficiencies. Believe it or not, what we eat and drink can make a huge difference. Treatment symptoms are very individualized based on the treatment dosage, type of cancer, and the person's ability to tolerate symptoms. This list contains several of the common symptoms that we most often address with our patients. For example, poor appetite, weight loss, and fatigue are common symptoms that I address in my patient population, whereas Michelle may commonly address dry mouth, thick saliva, and taste changes within her patient population. Because poor appetite is one of the most overarching symptoms during treatment, we will address this symptom first. Poor appetite can be due to multiple reasons, including additional symptoms like diarrhea or nausea, anxiety, environmental factors, medications, dehydration, and so forth. Regardless of why you are nauseated, the important part is how we can manage that symptom to reduce weight loss and poor nutrition status. As you can see on this slide, we want to first manage any underlying symptom like diarrhea or constipation, and we will discuss how to manage these symptoms later in this presentation. After we have managed underlying symptoms, I urge patients to change their mindset from viewing food as pleasure to viewing food as medicine or using food for survival. Setting alarms at certain times in the day to remind yourself to eat can be very useful when eating just does not feel like a priority to you. Additionally, eating at the same time each day often encourages the stomach to produce hunger signals and possibly a better appetite. Start small and set realistic goals. Goals that are too ambitious are not always achievable, and that's okay. It's one step at a time. One goal I always set for my patients is to reframe their mindsets from eating healthy foods to eating more calorically dense foods if weight loss or poor appetite occurs. This means putting more emphasis on milkshakes, ice cream, and other high-calorie foods than nutrient-dense foods like fruits and vegetables. Some additional recommendations include drinking beverages between meals to reduce early satiety during meals. Always experimenting and trying new foods to spark your appetite. And remember, no food is off limits if you are faced with prolonged poor appetite and weight loss. Try to get up and move as often as you can or as recommended by your medical team. Often, increased exercise can help improve your hunger and appetite levels. Track your calorie and protein intake on a nutrition app or computer website such as MyFitnessPal or NutritionIX Tracker, seen on the right-hand side of the slide. If you are unsure of your energy needs, reach out to your dietitian. When dealing with a poor appetite, we recommend that you consume foods and fluids that provide the biggest bang for your buck. Additionally, high-calorie and high-protein liquids are often easier to consume than sitting down to a large meal. If you would rather eat than drink your calories, we recommend making each bite of food the highest calorie and protein bite you are able to tolerate. Lastly, if you have the best appetite in the morning or in the evening, we recommend that you capitalize on those times to reduce weight loss. If you are having trouble preparing meals or getting access to meals, there are many options available for pre-prepared and even delivered meals. You can see some of the many options here. Listed here are some high-calorie options. This list is not comprehensive, but rather a couple of options to consider. If possible, we always recommend consuming healthy fats like oils, avocados, nuts, and seeds. For certain breast cancer patients, we do recommend to limit high-fat dairy. And if you have any questions about this, please reach out to your breast cancer dietitian. Again, as you can see here, there are additional options for high calorie, but also high protein foods to implement in your diet if you're feeling unwell. Some of these options include cheese, nuts, hummus, eggs, protein powders, whatever works best for you can definitely be added to your diet. As you can see here, there are many options for high calorie and protein drinks you can utilize in your diet to help meet your energy needs. This list is just a few of what we typically recommend to our patients, but there are many more to choose from. I often recommend that these nutrition supplements are utilized like Band-Aids in terms of utilizing them to make up for what you're unable to consume at meals and snacks. For patients that may need to watch their blood sugars, here's a list of some of the diabetic-friendly supplements that are available. Reach out to your dietitian if you have any specific questions regarding blood sugar control and supplements. Now, if you prefer to make your own high-calorie beverage, we encourage you to do so. There are many ways to make your own high-calorie smoothie or shake, so make sure you customize your shake based on your likes and needs. Remember, there are no wrong answers. If you rather eat your calories and protein or just want another way to increase your energy intake, there are many ways to add ingredients to get the biggest bang for your buck. Listed here are some ideas you can utilize.
Thanks, Mara. Now we will move on to another important and common side effect, and that involves your mouth, and that's oral care. Several cancer treatments can affect your oral health in a variety of ways. A few of these side effects are listed on this slide and include mouth sores, mucositis, which is inflammation and irritation to the lining of your mouth and throat, dry mouth, and even oral infections such as thrush. This can affect how we eat, drink, and talk, and can definitely affect our diet and nutrition. Depending on your treatment and recovery, it can be fairly temporary or it can last for several days. With good oral care, we can try to reduce the severity and improve your recovery time. So what are the recommendations for good oral care? First off, your dentist is an excellent resource for some additional recommendations, and some patients are actually advised to see a dentist before starting treatment. It is important to keep your mouth moist and stay hydrated. Sucking on ice chips while you are receiving certain chemotherapy drugs can help reduce the severity of the mouth sores and irritation. Continue to practice good brushing techniques with a soft toothbrush and overall good oral care. If you do not floss, consider flossing or using a water pick to ensure that you are keeping your gums as clean as possible. Do not use alcohol-based mouthwashes such as Listerine or Scope, as these can dry out your mouth and cause irritation. If you wear dentures or dental plates, continue to clean them thoroughly. If your mouth is very sensitive, consider only using these implants when necessary. Here is a homemade recipe for a milder mouthwash. This combination of baking soda and salt works like an antibacterial rinse that can help heal a sore mouth and clear out any thick saliva or secretions. Swish and spit, do not swallow. It does work slightly better when it is warm, but you can use this rinse hot or cold. A few food suggestions are listed here, but think of things that are soft and easy to chew and try to limit some of those dry, crunchier foods like chips or toast. These can be a little too rough in the mouth and cause more irritation. We want your mouth to heal as quickly as possible. If you are struggling with a sore mouth or sore throat, you may want to chew your food thoroughly and take smaller bites. We don't want anything to feel too rough or feel like it's getting stuck back there. In order to keep foods moist and add flavor, consider adding a sauce, a marinade, or even a gravy to your foods, and choose moist methods of cooking, such as steaming or crock-pot meals. But try to avoid anything too acidic, spicy, or salty. These stronger flavors can burn, and we really don't want that. Spicy chili or tomato sauce are not your friend when you are dealing with a sore mouth. Here are a couple of products that are currently on the market as of May 2022 to help manage your mouth sores. Oracoat Renewing Melts are a lozenge that contain hyaluronic acid and vitamin B12. They can stick to the side of your gums to help with healing and prevent any additional irritation. Best of all, you can continue to eat and drink when using them throughout the day. Glutamine is an amino acid that can help with healing and recovery. Helios is a glutamine oral rinse that is currently being researched to help prevent mouth sores and mucositis. And remember, mucositis is the medical term for irritation and inflammation of our mucosal layer in our mouth. This combination of a small amount of carbohydrate and glutamine can help with absorption and provide direct contact to the cells in our mouth that need the additional glutamine. Dry mouth can be another common side effect. It can be caused by a variety of medications and cancer treatments, so it is often difficult to pinpoint the exact cause. The most important thing to focus on is drinking plenty of fluids. This includes water, but other liquids and watery foods such as fruit or frozen popsicles or even ice cubes can be beneficial. Try to limit caffeine as it has a diuretic or dehydrating effect and can dry out the mouth. Sometimes sour flavors or even papaya can help break up thicker secretions, but be careful if you have a sore mouth in addition to dry mouth. If you experience dry mouth at night or first thing in the morning, a humidifier may be helpful on your nightstand or bedside table. Make sure to properly clean the humidifier on a regular basis. There are several over-the-counter dry mouth products. These are just a few that we like and recommend to patients. Your dentist is also a good resource for product recommendations, and they often even have samples as well. The Biotene Mouth Spray and Lubricity Spray are good portable options. The Xylamelts and Act lozenges can provide more of a long-term relief, but almost all of these products are temporary. Unfortunately, there really aren't many options that provide any long-term permanent relief for dry mouth.
Awesome, thanks, Michelle. So now we will change gears and talk about taste changes. So taste changes can be an undesirable side effect from chemo and radiation and can even cause poor appetite. There are 4 types of taste that our tongues pick up on, and it's sweet, sour, bitter, and salty. There's even one called umami as well. And so definitely there can be a lot of changes when you also put treatment in the mix. Some common taste changes that we often hear about are foods taste too sweet or too salty. Foods may taste metallic, or there may be no taste at all. And there are many others as well. A couple simple changes you can make to reduce the severity of taste changes are to discontinue or reduce cigarette smoking, to brush your teeth and even tongue prior to eating, using a baking soda salt water mouthwash prior to eating in pleasant surroundings, and to always maintain a good hydration status. Additionally, it is always a good idea to balance flavors within a dish. I often hear patients tell me that fresh foods like produce do not cause as many taste changes as heavily processed or shelf-stable foods do. Make sure to always try different preparation methods, new foods, and even consume foods at different temperatures to test the foods that may taste the best to you. First, we will discuss utilizing fat within our dishes to reduce bitter, salty, and sour taste. Fat is often key to providing balance and satisfaction within a dish. Try adding oils or even butter and avocado or even mayo to foods to override some of these taste changes. Next, we'll talk about acid. So if foods taste too sweet to you, we recommend adding an acid like citrus fruits or vinegar to help balance out that sweetness. Just be aware that acids can irritate your mouth, like Michelle was discussing earlier. So if you're experiencing any mouth soreness or pain, I would avoid adding an acid to your foods. One of the most common taste changes that I hear is that foods just don't have a taste or taste like cardboard. Now, if this happens to you, try using sea salt to help produce some flavor within your foods. Sea salt is recommended because it lacks bitterness when compared to regular iodized table salt. However, use whichever salt works best for you. The only caveat is that salt can cause high blood pressure or even fluid retention in some people. So make sure to reach out to either your dietitian or your medical team to discuss your salt recommendations. So sweet. Now this is for all the sugar lovers out there. The good news is that sweeteners help reduce other flavors in dishes, such as acidic flavors, bitter, or even salty flavors. We recommend using whatever works best for you. However, organic maple syrup works well for additional flavor and sweetness in a dish. The bad news is that sugar can increase blood sugars in certain people. If you are concerned about your blood sugars, I recommend trying monk fruit, which will not increase your blood sugars, but will still balance out the flavors. And again, reach out to your dietitian for your individual needs. So I do hear often that meats taste strange from my patients, and if this happens, I recommend to marinate it in your favorite marinade or even try a new one. If meat becomes unappealing to you, try different protein options such as tofu, nuts, nut butters, and dairy. As we discussed in detail, adding fats, sugar, and spices can help balance out metallic tastes. Now, if bitter or metallic tastes are something you deal with, we have some specific recommendations to help reduce these tastes. One, ensure that you are reducing the amount of canned goods you're eating from, because canned goods can take on a metallic taste from that can. Same thing with silverware. Try to use plasticware instead to reduce the metal taste. One thing that can help cleanse your palate is sucking on lemon drops or brushing your tongue and mouth to clear your mouth of bad taste. This is a product called MetQuil, and this product is a mouthwash that can help reduce metallic, bitter, or rancid taste. Some people find that this product relieves these tastes. However, not everyone finds relief with this product. I recommend trying some of the other recommendations prior to utilizing this product. If you do want to utilize it, I recommend going to metquill.com and purchasing from there. So one of the biggest questions that we get probably every day is, does sugar feed cancer? And since we discussed sugar in these slides in regards to balancing flavors, I wanted to discuss sugar feeding cancer a little bit. So first off, it's a myth. Sugar does not feed cancer any more than it feeds our brain, our muscles, and the cells in our bodies. Additionally, about 45 to 50% of our caloric intake needs to come from carbohydrates on a daily basis. And if you do reduce your sugar or even overall carbohydrate intake, what typically will happen is you will likely lose weight, which is something we don't want to happen during treatment. So what can you do to help reduce added sugars, but still consume enough carbohydrates? What you can do is eat more whole grains and fruits. Anything that has some fiber content to it can help slow down that sugar being digested and spiking your blood glucose. Now, what does the American Heart Association recommend? It recommends that we limit added sugars, but not natural sugars. So added sugars, we want to limit it to less than 6 teaspoons for women per day, or less than 9 teaspoons per day for men. So natural sugars are the opposite, where we don't want to limit natural sugars. Natural sugars are going to be things like fruit, bread, potatoes, things that just have sugar already in there. And that's the reason behind that is because there are many other good properties that outweigh the negatives of that sugar, as well as, again, we do need that sugar for our body. So the other thing I wanted to mention too is to liberalize your diet. If you're losing weight and you are worried about sugar, I would recommend liberalizing a little bit and letting yourself eat something rather than nothing, because again, our overarching goal is for you to maintain your weight while on treatment.
Thank you, Mara. Those are some really wonderful suggestions. Now we are going to move on to another common symptom and one that a lot of patients are concerned about, and that is nausea. Nausea can be caused by a variety of reasons, and these can often build upon each other. We want to prevent nausea as much as possible because it can lead to other problems. It can affect what we are able to eat and drink, which can lead to weight loss or abnormal blood work and potentially lead to a delay in treatment or a visit to the emergency room. For symptom management, you may be prescribed one or more medications to take at home for nausea. You may also receive some nausea medications through your IV before your infusion. Your team of nurses and providers will provide some additional details on medication management, but it is very important to notify your team if these medications are not working for you. Do not be afraid to be the squeaky wheel because we really don't want you to be nauseous at home. From a nutrition standpoint, focus on those small, frequent meals and take it slow in order to prevent feeling overly full or uncomfortable. When possible, drink your fluids separately from your meal. Some fluid is okay with meals, but try to drink the majority of your water or fluid in between meals. Again, we don't want to overwhelm your stomach and make the nausea worse. Make sure that you are sitting upright for at least 1 hour after eating the meal. If you lie flat after eating, it may feel like the food is coming back up, and that won't feel very good at all. For severe nausea, it may be beneficial to time your meals around your medication, and that may make sure that you're feeling your best whenever you are trying to eat during the day. Focus on bland foods, nothing too spicy or greasy. Sometimes a cracker or a piece of bread can help calm down the stomach. Rinse your mouth out with water or the homemade mouth rinse to clear any unpleasant smells or films in your mouth. Try using peppermint or lemon drops to freshen up your mouth. Peppermint has been researched for its natural anti-nausea benefits. Try to avoid skipping meals when you can. This can lead to poor appetite and snowball into other challenges. And finally, wear comfortable clothes that are not tight-fitting, nothing too restrictive. As a reminder, these are just a list of suggestions. What works for someone else may not work for you. There may be a trial and error period to find the best routine or solution for you, but we encourage our patients to continue to try things and continue to update the team on how you are feeling. Once the nausea subsides, and our goal is for it to go away as quickly as possible, you are welcome to return to your normal diet pattern. Additional food suggestions are listed on this slide. Sticking with the theme of nothing too spicy or greasy, sometimes high-fat foods can sit heavy on our stomachs and contribute to nausea, but not always. You may have heard of the BRAT diet before. This stands for bananas, rice, applesauce, and toast. It's a simple acronym that can help you remember to stick with mild, bland foods. However, this diet is meant to be used as a temporary solution as it limits a wide variety of foods and nutrients, including protein. If you do experience vomiting, make sure to sit upright, try to allow for small breaks to make sure that the episode has resolved before eating anything. Then start with clear liquids and gradually increase your diet from there. Make sure to call your medical team if you are unable to keep anything down for more than 24 hours. Here are some additional suggestions for nausea management that may be beneficial. Ginger has an anti-nausea soothing effect. Consider trying ginger chews, ginger tea, or even ginger candies. Bracelets or acupuncture can be helpful for some, and massage, yoga, or relaxation techniques can help reduce stress and distract the mind. We often hear from patients that this can be hard to visualize what a day is like with small meals. Over the next several slides, we will provide a timeline and layout of what to take in order to get in the recommended calories, protein, and fluid throughout the day. 2,000 calories may be too much or too little for some patients, but this is a good average to give you a practical example of a day or small meal. And we'll go through about 7 meals and sticking with the goal of every 2 hours. Starting off at 8 a.m., a breakfast would include a bowl of cereal, banana, and glass of milk or lactose-free milk. Plant-based dairy products are fine, but make sure to compare the calories and grams of protein as they vary greatly with plant-based dairy products. A snack around 10 a.m. includes a couple of hard-boiled eggs, cold to prevent less odor if tolerated that way, and toast and a cup of water or juice. The next meal around 12 p.m. contains a small amount of chicken and rice with ginger ale. So you can see that we are sticking with every 2 hours and mostly mild foods. The next snack at 2 p.m. is a small bowl of soup with crackers and an Ensure Clear. The Ensure Clear protein drinks can be sometimes easier whenever you're having nausea. So that is why we chose this product over the regular Ensure or Boost. Another small meal around 4 p.m. would include a good source of protein, crackers, and cup of water. The dinner meal contains a small serving of mashed potatoes, another clear protein drink. Here we've chosen Unduri chicken soup flavored protein powder that can be mixed with water. Finally, we have made it to the end of the day with our last meal of a Boost pudding and another glass of milk. We aren't saying that this is easy, but it is feasible, especially with the right team and support around you. Final tips: eat by the clock and stick with the schedule, keep a close eye on your weight, and contact your dietitian for more specific meal and snack ideas.
Great, thanks, Michelle. So now we'll discuss tips for reducing dehydration. So what are some signs of dehydration? Some signs of dehydration may be headaches, dry lips, dry mouth, low blood pressure, dizziness when you sit up, decreased urination, sleepiness, or just decreased energy in general. The best thing you can do, what I always recommend my patients to do, is to check their urine color. So every time you use the bathroom, I recommend that you look at the urine and evaluate it. Is it clear? Is it dark yellow? Is it brown? We want it to be either clear or light yellow. Any darker than that, we want our patients to keep on drinking. And when I say drinking, it can be any kind of decaffeinated fluid that works for you. So if you're not a big water drinker, you can drink juice, you can drink milk, whatever works best for you. In general, 64 ounces or about 2 quarts per day is the minimum of what we want our patients to drink. But again, please check your urine. So what are some products that can help with dehydration? So if you are dehydrated, whether it be from diarrhea or from nausea and vomiting, there are some products that can help replete those electrolytes and get those fluids into your cells a little faster. So some examples are Drip Drop, Pedialyte or even Pedialyte popsicles, G2, which is a Gatorade product, Liquid IV, and you can make your homemade drinks as well, which the recipes will be on the next slide. So these recipes are ones that you can make on your own. If you have these products in your pantry or at home somewhere, you can make these yourself, and they will be, equatable to the products that were on the previous slide. So let's say that you're unable to drink a lot of fluids, or you just need some extra fluids within your food. There are a lot of foods that have a high fluid content. These foods are things like fruits, like watermelon or berries, popsicles, soups, broths, ice cream, sherbet, even ice chips, and even the nutrition supplements that you drink. So let's say you have been recommended to drink Ensure. You might think of Ensure as a high calorie, high protein meal replacement, However, it does have fluid within that as well, so it can contribute to your fluid status. Here are some ideas to kind of keep you on track with your fluids. So one is I always recommend my patients to set alarms. I always recommend setting alarms for every 2 to 3 hours to remind you to either eat or drink. You can also have products in your home like the water bottle that lights up when you need to drink a little bit extra. You can get the water bottle that has the increments on there so that you can keep track yourself, or even have an app or a journal to keep track yourself as well.
Thanks, Mara. Moving on to some of the gastrointestinal issues, what can I do to prevent and manage diarrhea? First off, it's important to define what diarrhea truly is. So diarrhea includes both loose and watery stools and bowel movements more than 3 times a day. Acute diarrhea lasts only 1 to 2 days, all the way up to chronic diarrhea more than 4 weeks. Similar to some of the other symptoms, diarrhea can be caused by a variety of reasons. This includes the cancer itself, unfortunately. It could also be caused by the treatment, medication, or an infection, even brought on by the stress of your diagnosis or upcoming treatment. Diarrhea can lead to several complications, including dehydration, difficulty absorbing all of our nutrients, or loss of nutrients such as potassium or magnesium. It can lead to weakness or weight loss due to the loss of fluids, which can affect your appetite. We often hear the statement, "Why should I eat if it is just going to go right through me?" And that is completely understandable and why we need to address the diarrhea to get you feeling better. So what are some tips for diarrhea? Make sure to take the antidiarrheal medication as prescribed. Although dietitians are all about food first, this is a situation where a medication is needed to stop or slow things down. Try to stay hydrated by drinking plenty of fluids, but avoid the sugary drinks. Concentrated sweets can cause an osmotic reaction in your intestines and make the diarrhea worse. So select lower sugar products such as the Pedialyte that Mara mentioned. Consume foods that are high in those electrolytes, such as sodium and potassium, and foods that contain a specific type of fiber called pectin can help absorb fluid in the bowels and slow down the diarrhea. Soluble fiber like pectin mentioned in the previous slide can create a gel and absorb some excess fluid. This can help to slow things down, but speak with your provider or dietitian to see if this is an appropriate option for you. Banatrol or dried banana flakes works in a similar fashion. We have a lot of success with this product and recommend it on a fairly frequent basis. Banatrol is mixed with drinks or soft foods and consumed 2 to 3 times daily. Some cancers may need additional enzymes to promote digestion and absorption. Make sure to call your provider if the diarrhea continues, if the stools are an unusual color or odor, or if you are having additional symptoms, or if you are receiving immunotherapy. This slide shows some additional foods to be cautious of while you're experiencing diarrhea. Once the diarrhea resolves, you can slowly resume to your typical diet. Lactose in standard dairy products can sometimes be hard to digest and can contribute to diarrhea. Temporarily transition to lactose-free options or plant-based products for the time being. Limit high fiber foods, especially foods higher in insoluble fiber, which includes things like vegetables and certain nuts. Limit sugar-free products that contain sugar alcohols because these molecules can often cause GI upset and contribute to diarrhea. Moving on to things that should be avoided, really want to watch out for those gas-producing foods such as broccoli, cabbage, or beans, and limit alcohol and caffeinated beverages when possible, as both of these can cause diarrhea and dehydration.
Great, thanks, Michelle. So now that we've discussed diarrhea, we're now going to discuss constipation. So the big question is, what is constipation? And generally speaking, constipation is characterized by no bowel movements within 3 days. However, constipation can also mean solid stools that are hard to pass or inadequate emptying of the bowels. The best thing you can do is to understand what your normal is and to monitor any changes that you notice. There are a lot of reasons why someone might become constipated, including treatment, medications, changes in activity level, dehydration, lack of fiber intake, and so on. To help become more regular, we recommend setting a bathroom schedule to allow your body to synchronize with your schedule. Additionally, try creating that schedule around your meals. For instance, using the bathroom after eating can be the best time to promote bowel movements because the gut is working the hardest and is activated at this time. You should also increase your hydration, especially if you're increasing your fiber intake. If those tricks do not work, we recommend consuming warm, sugary beverages to increase the activity in your gut. And if possible, try to move more often to increase gut activity. So I will briefly discuss fiber. Fiber is a part of a food that helps things move through your GI system a little bit faster. So if you are dealing with constipation, fiber can kind of help clean you out a little faster than if you weren't consuming fiber. The big caveat here is that we need you to increase your fluid intake while you're increasing your fiber intake to really help the digestion and to reduce any kind of stomach upset. If you're looking at a food label, make sure that the food has 3 grams of fiber or more per serving, or that you're choosing foods that are more plant-based, like fruits, vegetables, whole grains, beans, and so on. Here are 2 recipes that you can try to increase the fiber in your diet. So feel free to be creative and create your own high fiber recipes. This recipe on the left is for fruit and bran, and you can put it on a piece of toast in the morning to kind of get things going. Or power pudding on the right is a good one to consume throughout the day or even in the morning again to get your body to get your bowel movements moving. Here's some complementary therapies, stomach massages. Have your friend or family give you a little bit of a massage, try to get some things working there. Yoga and stretching can be very beneficial as well. And then the way you sit on the toilets is can be very conducive to producing a bowel movement or can not be so. So make sure that you try some of these little tips and tricks as well as you're trying to figure out what works for you. So the other type of constipation is called opioid-induced constipation. And so there's a couple of recommendations that are specified towards this type of constipation. And those recommendations are really just to provide adequate fluid intake, exercise or movement, whatever you're able to do, and a regular balanced meal pattern. Now, it's not necessarily recommended to increase fiber in general with opioid-induced constipation because it's the medication that's causing the slowing of the bowel movements through your system. However, soluble fiber is okay. We really, really want to reduce the insoluble fiber, and that's what is shown on the right, the difference between soluble and insoluble. However, in general, we don't necessarily recommend an increase in fiber. So here are some examples of laxatives and stool softeners that you may be prescribed or use if you have opioid-induced constipation or just constipation in general. These will be recommended or may be recommended by your medical team. So definitely reach out to them for specific recommendations. But here are just some information on how they work and what they're called. Again, we do not want you to take any kind of fiber medication or supplement or anything like that because of the opioid-induced constipation. In addition, there are also prescriptions that your medical team can prescribe to you. If the previous slide, those did not work. The big thing here is that reach out to your medical team. If you have any concerns, questions, or if you are dealing with constipation, they are the best contact to help provide you with recommendations based on your individual needs. Here's some additional resources. These are resources that, you know, us dietitians use on an almost daily basis. At the bottom is the UT Southwestern Oncology Nutrition website. That's a great one to go to. A lot of information just based on what we provide and recommend within our patient populations. American Cancer Institute for Research is another great one. So reach out to either your dietitians on your team or to these resources for more research-based information. And thank you everyone for listening into this presentation. If you have any questions whatsoever, please reach out to your medical team. And if you don't know your dietitian, they can let you know who that dietitian is. And if you do know your dietitian, please reach out if you have additional questions. Thank you so much and have a great day.
Thank you.